on their leg with delayed healing. The patient is triaged and is taken back to a room to be assessed by the nurse.
Hi, my name's Ella. I'm going to be your nurse today. What made you decide to come into the hospital?
Hi, so I've actually been kind of deciding whether to come in for a little bit. I have this wound on my leg right here, and it's not healing. I've had it for probably a month now, and there's been no progress really. I mean, I don't know, you probably know better than me. And then I've gained so much weight in the past couple weeks.
Okay, how do you know the number of pounds?
Well, I would say probably about 10 pounds.
In the last,
I don't know the exact day, but last couple weeks or
last
so.
2 or 3 weeks?
Yeah.
Okay,
Mm-hmm.
okay. Are you taking any medications?
Yes.
Okay, so you have an albuterol
Yes.
inhaler.
Yep.
Beautiful.
Yeah, my albuterol, and then I'm also on a steroid for that because I just got diagnosed with asthma.
Okay. Oh, I do see in your past medical history that you were diagnosed with asthma. Do you have any other past medical history I should know about?
No, I mean, everything's been good. I'm not sure if there's anything else.
Okay. All right. Do you mind if I do a physical assessment?
Yes, go for it.
Okay, great. All right. I'm going to do a physical assessment on you, if that's all right.
Mm-hmm.
Tell me more about this weight gain that you've been experiencing. Do you notice that it's that you're gaining the weight in any particular area?
Yeah, it's in my abdomen and
Okay.
Honestly, it's almost in my face too, and then
Your cheeks
back.
have gotten rounder?
Yes.
Yeah, okay.
And then I've been having acne and I never break out.
Okay.
So it's
So you usually have clear skin and just in the last little bit.
And now I'm gaining weight and I'm is it my diet? But my eating has remained the same, so I don't know.
Okay, so your diet and exercise has been the exact same.
Oh yeah.
Okay. All right. Well, I'm going to give a listen to your heart and lungs. I want to do a skin assessment, check out that wound, all right?
Okay.
So just take a deep breath whenever you feel my stethoscope, okay?
Okay, sounds good.
All right. I'm just going to listen to your belly sounds, make sure everything's moving okay. All right, sounds good to me. I'm going to hold your hands really fast, check your pulses.
Okay.
Okay. Good. Good. All right, I'll have you squeeze my hands. Awesome. And then pull my hands towards you and push away like a gas pedal. Awesome. All right, and which side was the leg wound on?
The left.
The left side here. Oh yeah, okay, so tell me about more when you got this, how long it's been here.
I got it probably about a month ago, and it's been here, and it just hasn't changed at all.
Okay,
and
it's the same as when you got it?
literally the exact same, and it's honestly so weird because this has never happened to me before. Normally my body heals on its own. I don't really need much attention unless there's an infection, but this just hasn't
All right,
been healing.
all right, so you can sit up.
Okay.
I'm gonna phone the doctor, let him know about the physical assessment findings, and he'll come in and see you shortly.
Okay,
Right?
sounds good. Thank you.
Yep. Hi, Dr. Ferris. I have a 35-year-old female who came in with unexplained weight gain and a leg wound that won't heal. I performed a physical assessment and found a few things. She's had the weight gain. It's in her abdomen, up by her shoulders, on her face. Cardiorespiratory, GI all seemed pretty normal. But then that leg wound, it's just the same as when it started. What would you recommend as next steps?
I would like to start some blood work samples from her and maybe order a CT scan to look for any potential tumors. I'm suspecting that there is an endocrine issue going on here, and I want to get the full picture of what's going on. So we can treat the underlying cause. So why don't we get the blood work started first?
Okay, awesome. Okay, so UAP Sky. Can you get a blood draw from this patient? So a CBC, BMP, urinalysis, and a plasma adrenocorticotropin stimulating hormone, and a saliva sample would be great.
Good.
The patient needs a head and abdominal CT, and can you take them down to CT now? Report back to me when you're done.
Sounds good.
Thank you.
Hi. All right, your nurse sent me in here to do some labs for you. I'm Skylar, I'm the tech here.
Hi, nice to meet you. I'm Hannah.
So she just wants to the doctor ordered some labs for you, and then I'm gonna take you to CT to look at your abdomen and get a look at your head afterwards. Is that okay?
Yeah.
Okay, so I'm gonna use this arm,
Okay.
and we'll get you going, okay?
The UAP starts an IV and draws the ordered labs. She also obtains a saliva sample to look for cortisol levels. The patient is also taken for a CT abdominal to take a look at the adrenal glands and a CT of the head to take a look at the pituitary gland. The nurse sees that the patient's labs and CT are back, which states the following: white blood cells 14,000, hemoglobin 13, and hematocrit 15%. Platelets and lymphocytes are both normal. For the BMP, the glucose was 190 and the sodium was 160. In the urinalysis, it was positive for glucose and negative for ketones in blood. The serum cortisol was 35. As for the CTs, no abnormalities or masses were present on or around the pituitary gland or on the abdominal cavity.
Okay, so it looks like the CT of her head and abdominal area came back unremarkable, so that eliminates a tumor as the cause of the elevated cortisol levels. However, because of her labs, I suspect that potentially her steroid use might have something to do with this, and we might need to change her meds around. I am going to admit her to complete a dexamethasone suppression test and a 24-hour urine test to confirm the diagnosis of Cushing's disease. I am also going to consult endocrinology and also going to get in touch with her PCP to discuss a new medication going forward with her asthma. I will be in to see her shortly and explain the plan going forward.
Okay, great. I'll get together a report for admitting her upstairs.
And I'll get her things together to get her to transport.
Great, thank you. Alright, so that's the plan. We're going to get you upstairs. Your nurse will be in shortly.
Okay.
Hi, it's Nurse Ella again. How have you been feeling?
I'm feeling okay. I just have some questions. The doctor came in. I'm not even sure if I really understand what Cushing's is.
Oh, okay. So did the doctor discuss with you that there were no masses on your CTs or anything like that?
Yeah.
Okay, good. So we're thinking that maybe that you might have something called Cushing's disease.
Yeah.
That's an endocrine disorder, which means that some of
Okay.
your hormones aren't working the way that they should. Cushing's disease specifically means that your adrenal glands are producing too much cortisol. Do you know what cortisol is?
I've heard of it, but I'm not actually sure what it does.
Yeah, so cortisol is a hormone that's associated with stress. So if the body is releasing too much cortisol, that means that your body is constantly in a state of stress. And one of the things that stress does is it causes things like weight gain or breakouts, fatigue,
Oh yeah.
slow healing wounds, and that's the findings that we're seeing with you.
Yeah.
So sometimes what can cause this is a tumor on the pituitary gland or on the adrenal glands, but we saw on your CAT scans that there's no tumor, so we don't have to worry about
that made me so worried for a second.
But yeah, so it's not a tumor.
Okay,
So you can take a deep breath. But sometimes Cushing's can develop from long-term corticosteroid use, and you've been using that steroid inhaler.
For my asthma.
Yes.
I didn't even think
That's
of that.
right. Yeah. So
Okay.
we might talk about some treatment tweaks for your asthma.
Okay.
So we're gonna take you upstairs soon, get you admitted.
Yeah, so the doctor was also saying, like, we're gonna go upstairs. What does it mean, go upstairs?
Yeah, so our goal with you is to, for what's going on, is to treat the underlying cause.
Okay.
So because your CT scan showed no mass,
No cancer.
no cancer,
good.
no tumors, no
Yeah.
anything. We're gonna turn our attention to the medications that you've been on. If it was a mass, we would be looking at potential surgery to remove the tumor, but because it's not, we're gonna do some medication tweaks.
Perfect.
And we'll do that upstairs when you're admitted.
Great. So I guess thank you so much for your help. I feel like a lot better now about everything. So
I'm so glad.
I really appreciate it.
All right, I'm gonna call the nurse on the floor to give report.
Great.
We'll get you upstairs soon. You have your call bell?
Yes, I'm
Okay, you know how to reach me if you need anything?
Yes, just press the button.
Okay, awesome. All right,
Okay.
door open or closed?
Door closed.
Okay, all
Thank
right,
you.
see you later.